Hi everyone, my name is Alicia and my teammates' names are Olivia, Sophie, and Mia. And today we'll be talking about an investigative approach to new uses for our molecule, fluoroestradiol F-18. Here is the chemical name and the structure of our molecule. Fluoroestradiol F-18 is the generic name of our molecule, and Cerianna is the brand name. Cerianna is manufactured by Xynexa USA and PetNet Solutions Inc., and it was recently FDA approved in 2020. Our molecule serves as a radioactive diagnostic agent that when used with a PET imaging machine, it can detect estrogen receptor positive tissue damage for women with metastatic or recurring breast cancer.
Currently, Cerianna is used to detect recurring tumors in women who have or have had estrogen receptor positive metastatic breast cancer. This fluorescent tracker binds to the estrogen receptors, and then PET scan imaging can detect lesions that have irregular numbers of receptors and identifies areas of tissue that may be or become metastatic. The imaging should be followed up with a tissue biopsy and pathology reports to confirm diagnosis. A current limitation of this molecule is that it's not useful for detection and imaging of other receptors associated with breast cancer, such as human epidermal growth factor 2 and progesterone. As of right now, there are no current contraindications for this drug.
Our molecule is analog to estrogen. It binds to the alpha and beta estrogen receptors, where there is then a conformational change and receptor dimerization. The complex is then translocated to the nucleus, where it carries out the estrogen response, binding to the promoter region and proceeds with gene expression.
Fluoroestradiol has a high binding affinity for estrogen receptors with a KD of 0.13 nanomolar. For comparison, the KD for the estradiol estrogen receptor is 0.15 nanomolar. Fluoroestradiol has a high binding specificity for estrogen receptors with a Bmax of 1901 f-mol per milligram and an IC50 of 0.085 nanomolar. Fluoroestradiol is intravenously injected over 1 to 2 minutes and is recommended to begin imaging 80 minutes after administration. Fluoroestradiol is delivered this way because it's a heavily protein-bound drug that would otherwise be degraded in the stomach if taken orally. Fluoroestradiol has a very short duration of action. After injection, 95% is bound to plasma proteins. After 2 hours post-injection, the drug is at less than 5% of its peak circulation concentration. Unbound metabolized FES F-18 is distributed to multiple parts of the body, as seen on the slide. Fluoroestradiol is highly metabolized by the liver. After 20 minutes post-injection, around 80% of it has been metabolized and are products of glucuronide or sulfate conjugation. Metabolized FES F-18 binds to globulin and albumin and is eliminated via the urinary and the biliary system, which includes the gallbladder and the intra and extrahepatic biliary tree.
Cerianna has very few side effects. In less than 1% of cases, patients have experienced soreness in the arm where the tracer was injected and dysgeusia, which is an alteration of perception of taste. This is due to a known relationship between radiation and loss of salivary tissue. There also have been no studies done yet to evaluate whether Cerianna has a long-term impact on fertility in either women or men. For the PET scan, the test may affect blood sugar to the concern of diabetic patients, and there are also natural risks to radiation since a single PET scan is equal to about 5 years of background radiation. There are also few medical preclusions. There has been limited research showing decreased efficacy in geriatric patients and no research in pediatric patients. There are also possible allergic reactions to the drug. For the PET scan, it precludes pregnant women and warns those breastfeeding of the risks of radiation.
For the new use of our molecule, we wanted to look at its application to endometriosis. Endometriosis is a very painful disorder that occurs when tissue that normally lines the uterus grows outside the uterus and on other areas of the body. Endometriosis is heavily estrogen dependent. During the menstrual cycle, the ovaries produce estrogen, which signals for this tissue to grow, which can then lead to inflammation and internal bleeding.
Ectopic endometrial tissue can implant in several locations it was not intended. Here you can see it attaching to the uterus, fallopian tubes, and ovaries, but the reality is that it can go all throughout the body, including the heart, lungs, and brain.
Endometriosis affects 10% of women, and it takes an average of 7.5 years to diagnose. And this is really scary because about 30 to 55 or 50% of women who have this disorder are infertile. The current diagnostic methods include pelvic exams and transvaginal ultrasounds. One reason why endometriosis is so hard to diagnose is because it's nearly impossible to identify endometriosis until the condition has progressed to a cyst forming.
Now we can introduce the new application of our medication. We are proposing the new use of fluoroestradiol as a method of diagnosis for endometriosis by identifying estrogen receptors in atypical regions throughout the body. To do this, fluoroestradiol will be injected intravenously, and a PET scan will occur within 20 to 80 minutes of the injection. The molecule will attach to these estrogen receptors and light up in the PET scan shown to the right. It is recommended that patients get a follow-up biopsy after a positive test result to ensure that the accumulations seen are not indicative of cancer. The use of fluoroestradiol as a diagnostic tool for endometriosis is revolutionary to the medical field, as there's currently no definitive measure of indicating if a patient has this painful disease. Not only does it cause women pain, but it's also a contributing factor to infertility and several other ailments, and this can now be used as an additional test to indicate reasoning behind these diseases. This test allows physicians to come up with a treatment plan based off of a definitive diagnosis and not just their own intuition. In the US alone, there are 166.7 million women, roughly 10% of which have endometriosis. Of that number, 38.4% of women go to the gynecologist regularly, expanding the current market size by over 6.4 million people.
To summarize, our drug Cerianna is currently used as an estrogen receptor marker in metastatic breast cancer. We're proposing to repurpose this molecule to detect endometrial lesions and put a practical screening tool for endometriosis on the market where there currently is none. If you look at the statistics on the right, lack of diagnosis of endometriosis is a huge problem in women's health, and our solution will hopefully alleviate both the physical and emotional burden on women and integrate endometriosis screening into the standard of gynecological care. Any questions?